Assistance with the operational oversight of Mecosta Health Services. Mecosta Health Services is owned and operated by the hospital. It was developed because we were losing physicians in this community left and right, and we needed a way to keep them, so we started employing them. John has been there, John Curry, from its inception as the board chair. Scott Vanderhill was the one remaining family practitioner in town several years ago, and he was leaving. And we said, Scott, if you'll stay, we'll form a corporation, we'll use you as the nucleus of this, we'll recruit you partners, we'll build a building and so forth, and all that's happened, and now we have, Nettie, help me out, Joe, around 20 physicians that are employed at the hospital. A few years ago, we didn't have any. It's the only way you can recruit physicians in this day and time. Access to planners, architects, attorneys, quality experts, what I often refer to as bench strength. Just this week, Tuesday, we had a 4-hour in-service with all the directors of the hospital with an expert on what's called lean management. It's like Six Sigma. It's a way to improve the quality of what you do, patient care, at the same time reduce cost and waste. And it was a Spectrum employee that came up and assisted with that. Capability, expertise, and science to deal with the Healthcare Reform Act. None of us in healthcare really know where this thing's going to end up. It is out there on the books right now. I think most of you know the House of Representatives changed from Democratic to Republican in this last election. There is some talk that part of this act will change. Others say it's so complex that leave it alone and let's try to work through the maze at this point. The expertise they bring to help us with this is a main reason for joining. Affiliation with the health system rated as one of the top 10 in the United States. Johns Hopkins, the Geisinger system in Pennsylvania, the Mayo Clinic, Kaiser Permanente, Cleveland Clinic, Spectrum, all mentioned in the same breath. Top 10 systems in the United States. Fortunately for us, one of those, Spectrum, happens to be just 50 miles down the road on a main interstate. So that's fortunate for us. This is another one I starred, probably the second or first most important slide. All of the hospitals who have previously merged with Spectrum are extremely happy with their decision, have more employees than prior, have expanded services, and they have a better bottom line. The reason I can say this with 100% assurance is that the Board of Trustees have visited Greenville and talked to their staff and board employees. They visited Gerber, took a team there. They've visited with Reed City probably at least 4 times at this point, and they've asked the questions you're interested in every which way you can think of. Did you have job loss? Were there layoffs? Do you still get to make decisions? What's your experience have been to this point? And it's always been positive. They've tried hard to dig underneath to find something that wasn't so positive, haven't been able to find it, and you can ask the board members about that. This is a quick fact sheet. This is last year's fiscal year for the hospital. Our fiscal year starts July 1, ends June 30th. The gross revenue for the year was about $87 million. The net revenue, $47 million. Expenses of $47.5 million. We had an operating margin of $100,000. This includes the hospital and Mecosta Health Services combined because they're both owned by the hospital. In simple terms, for every dollar of charges or revenue that we have, we only make about 50 cents, and that's going to continue to get worse with healthcare reform and the mandates that are on us. Expenses continue to increase. I wanted to mention we do have now, both practices combined, a total of employees and bodies that work there, 521 bodies that are employed at the hospital. The 428 would be full-time equivalents if everybody, all 521 were full-time employees. I think, actually, Nico, I think I read it in your column, second largest employer in Mecosta County, is that right? Mm-hmm. I follow what you write, so I know what's going on. It helps me, thank you. Additional relevant information. Board of Trustees would remain local. No question about it. Hasn't even been an issue. The 9 now would remain. They would interview prospective candidates. They would submit those names to Spectrum, just like they submit the names to the county commissioners currently for approval. A couple of other people would be added, the CEO, whoever that is, when that comes up, and the chief of the medical staff. Right now it's myself and Dr. Hecht out of Canadian Lakes. We attend every meeting anyway. This just gives you voting capability. And then Mark sits on the board of all those hospitals, and then Dr. Rogers or another physician will sit on the board representing Spectrum. The hospital would remain not-for-profit. This is another one of those things sometimes that maybe not everyone is aware of. Spectrum itself is not-for-profit, so there would be no change in that regard. The medical staff has given their full support to the merger. These are quotes from the medical staff. The benefits of an integrated system outweigh the loss of autonomy. Only way communities our size can manage a modern hospital. The economics of medicine require mergers of this sort for small institutions such as MCMC to remain viable. We actually did a written survey with all the physicians and did not get one physician opposed to the merger, and these are their comments. All the physicians currently practicing in Big Rapids and Canadian Lakes would continue to do so. I've already mentioned that. Employee forums have been held on all shifts, and all issues or concerns have been consistently addressed. I think if you read Nico's story, I've got I'll call it a website called the Spectrum Journey that I constantly put out updated information on for all employees to read. We had 9 forums for the 521 employees. We had 57 employees attend. Also, employees have the ability, and many of them do this, send me individual emails. Well, I'm a 0.6 FTE. I'm eligible for full-time benefits. Will I still be eligible when Spectrum comes in? And so and then I write back and say, at this point, all the hospitals from an HR standpoint are different. It might change someday. Right now, you would still be eligible. So it's that sort of back and forth with all the employees on a consistent basis. MCMC and Reed City would not be combined as one hospital. One of those things I think has been talked about some as well in the past. The 2 hospitals will remain in their local communities, but they'll work closer together in the future. There are some real benefits working closer together. Reed City has a fabulous cancer program at Crossroads, and we're in the middle of a $10 million, hopefully approved, expansion for Reed City. And we've also had Susan Wheatlake up to discuss how her program might blend in with that. There would be no reason for us in Big Rapids to duplicate that. They do not have a birthing center. The birthing center here is exceptional. 700 births a year. There'd be no reason to duplicate that. There's a home health program here that's growing leaps and bounds and will fit right into what healthcare will look like in the future with the patient-centered medical home, et cetera. There'd be no reason to duplicate that. We have had those discussions to actually grow those programs at each place and not duplicate them. Whereas if we were still competitors, we might think seriously about going head-to-head with a cancer program, or they might build a birthing center, and there would be no need. Continuing, the foundation and the auxiliary would continue to operate as is. Any money raised locally would remain to support the hospital. I've actually made presentations to the foundation and the auxiliary separately already and answered all their questions, and they, I think, feel very comfortable at this point. They will just kind of continue to rock and roll like they are. 100% of funds raised locally will stay locally. All the hospital's current assets will remain in our community. And really, when I say this, I'm talking more about physical structure. The hospital proper will remain where it is and support the local community. Last couple of slides. This is kind of interesting. Those of you that know Margaret Ross that's sitting up here, who's a friend and a neighbor, gave us this picture, and it's just spellbinding, actually. This is the hospital. This is Winter Street, this is Oak Street, and this is Locust. This Mrs. Ross lives right here. This happens to be all of Ferris State University. This is 1932. One of the things that, and I mention this because this is talking a little bit about how the hospital, maybe the word's transition, the modern word might be morphed over a period of years from one thing to another in order to survive. In 1879, the Sisters of Mercy built the original hospital in Big Rapids, and then they ended up having to build it 3 different times because it burnt down. I think the original one was at the fairgrounds, and then it moved downtown and so on and so forth. In 1926, in fact, the headstone is still right here. The hospital, pardon me? Cornerstone. Thank you.
Yeah. Not good to have headstones in hospitals. Bad advertising, Sam, bad advertising.
It's time to sit down, isn't it? Thank you, Dr. Beard. The cornerstone is right here, 1926. At this point in time, the Sisters of Mercy were unable to continue to fund the hospital, so it was taken over by the city of Big Rapids. And then in 1975, the city struggled and had to work to raise money to keep it going. Some money was raised locally, the old Taggart wing, etc. Then in 75, it was taken over by the county. And then in the late 80s and early 90s, even though it was still a county hospital, different management companies were brought in to help run it. And now with healthcare reform, it's really going to take as much bench strength as we can muster to keep it going in the future, and that's part of the reason why we would think it's in the best interest to hook up with Spectrum. One thing that I wanted to mention about this, I have people ask me all the time, why in the world did the city build a hospital in a neighborhood? And then when I look at this, I think, oh my goodness, they didn't. They put it in the back 40. And the neighborhood grew up around it. So actually, it was well thought out. There were no homes, schools, or anything here. But yet it is a pretty cramped neighborhood as we speak. This area actually burnt down at 1.2, and of course, obviously now it's been rebuilt. Okay, change equipment. Thank you again for that picture. I've really enjoyed that. Same sort of thing here. So in the 30s, this is what we just talked about. This is Winter Street, the administrative interest. This is an old building that we cannot put patients in at this point because it's got a wood frame structure. This is part of the Taggart wing and the piece that was added in the 70s. This is the early 80s and the emergency room when it was new at that point. This is the early 90s when we built the birthing center and the what they call the LDRP, labor, delivery, recovery, postpartum beds. The individual patient rooms with an individual bath and shower, if you've been in that at all, you know how wonderful it is, and that's what we need to do with patients up on the medical floor as well. And then on top, we started the inpatient physical rehabilitation unit. Susie Pierce runs. And again, it's hips, knees, strokes, and so forth. This service did not exist prior to this. Okay. And this is the artist's rendering of the new ER-OR project, the new front entrance, the 4 surgical suites, and the 18 beds in the emergency room. And we've now, since then, added the digital mammography. In summation, Spectrum Health is based in West Michigan, ranked as one of the top 10 health systems in the United States. It has a reputation for exceptional quality, and it's financially strong. We are convinced they represent the best long-term strategy for our hospital here in Big Rapids.